professors, all faculty members, fellows of PSN, fellows of the WBCP, food pharmacists, and our technical team. We are delighted to have you join us as we explore this topic, which is actually relevant to our professional development as pharmacists and as educators. Module 1 serves as the foundational entry point to the GDP-SA Teaching Certificate Program. Its purpose is to orient you to the roles, expectation, and the core principle of teaching in pharmacy education. This module will be anchored by Dr. Teresa Pons and Dr. Anissa White. Before we begin, kindly ensure that your mic is remain muted unless invited to speak. Questions may be submitted to the chat box and will be addressed during the discussion section. At this point, I'd like to introduce our speaker, starting from Dr. Teresa Pan. Dr. Pan is a clinical pharmacist, educator, and global health leader with over 20 years of experience in pharmacy practice, teaching, and mentoring. She serves as a CEO of Clinic Pharma Global Health USA, and she is the founder of the West African Society of Parenteral and Enteral Nutrition, WASPEN. Dr. Pans earned a PharmD from Mazda University, where she also served as an adjunct professor and precept pharmacy student. Her work focuses on clinical pharmacy practice, HIV care, metabolic and nutritional support, and the development of pharmacy training program. She has played a key role in establishing international pharmacy residency and education program in West Africa, and remains actively involved in mentoring pharmacy practitioners and advancing pharmacy education globally. Now, let me quickly introduce the second speaker, Dr. Anissa White. She is an accomplished scholar, educator, and academic leader with more than 2 decades of experience in pharmacy education, health outcome research, and student success. She had a PharmD and MS in pharmacoeconomics from Florida A&M University and a PhD in health service research from the University of Florida. Dr. White joined the UNT Health College of Pharmacy in 2015 and currently serves as Senior Associate Dean for Strategies Initiative. She previously served as Interim Dean 2023 to 2025 and as Senior Associate Dean for Assessment, Accreditation, and Faculty Success, where she played a pivotal role in securing the college's 8 years ACP re-accreditation. She also served as Interim Chair of the Department of Pharmacotherapy and was awarded tenure in 2021. A professor of pharmacotherapy, Dr. White teaches in the Applied Outcome Research Certificate Program and has delivered lectures at Florida A&M University, the University of Florida, and Mazda University. Research focused on health services, patient safety, AI, managed care, pharmacoeconomics, and outcome research. Research involved a team approach to care, examining the various aspects of healthcare and how entities can join together to enhance effort. Dr. White has been active as a mentor and leader in various professional pharmacy organizations, including the Academy of Managed Care Pharmacy and the Professional Society for Health Economics and Outcome Research. Dr. White has published several peer-reviewed articles and authored a textbook entitled Introduction to the Pharmacy Profession. At this point, I want to welcome them to give their lecture, starting from Dr. Pans. You have the floor, please.
Thank you. Can everybody hear me?
Very well.
Yes.
Yes, we can hear you very well.
Oh, wow. This is really exciting to finally have this program in West Africa and to have esteemed fellows join us. So thank you, Dr. Bello, for that introduction of both of us. Very much appreciated. So it says Pharmacy Teaching Certificate Program, but I know it's actually, we're looking at the pharmacy teaching diploma program. I think you guys will get that change eventually. So what we're going to be talking about today is the module 1. So I will start the introductory, and then Dr. White will end the other half of it. As already said, module 1 serves as a foundational entry point to the GPDSA teaching certificate program. And I think it helps for you all to know who the GPDSA, what that stands for, who we are. You heard a little bit about what I do in the United States. I think I feel very, very privileged as somebody who is from West Africa and Nigeria, and who has been practicing here for a couple of years, to have the opportunity to identify talents in my field of clinical pharmacy. And in doing so, I'm able to get those talents together, and we come up with different initiatives. And I'm also blessed to have an organization as WAPCP that allows me to present what I have, and then we collaborate and bring best practices to you all. And that is how this teaching certificate is one of them. And Dr. White was one of the talents that I had worked with for many years here in US, and a lot of the speakers were also that are made up of this GPDSA are also involved in this program. So you all will get a chance to hear them. So the primary purpose of this teaching certificate, the module 1, is to introduce you to teaching roles across didactic, experiential, and clinical practice settings, to get the opportunity to hear what we do here, and then, of course, to exchange ideas in terms of how we can do things. You'll be introduced to core concepts of adult learning and learning diversity. You'll get to hear about the Bloom's taxonomy as a framework that is used as a framework for instructional design. Dr. White will end with that part, and then look at the development of teaching philosophies and syllabus. Next slide. This is going to be a 6-month live teaching program, but Professor Para you pretty much know that we're going to have like 3 months, I believe, for the exam and all that, but the live program is going to be 6 months. The module 1 will also provide the intellectual and professional groundwork upon which all the subsequent modules will be built upon. All right. So I mentioned that it introduces the educational terminology and framework that will be reinforced throughout the different modules here we hear. It will also establish expectations for reflective practice, professional growth, and documentation. It will help with the initiation of development of key portfolio components that can evolve over time. I think one thing that I also think would also help here, will allow exchange of knowledge and discussion of what is being done here in US, and then we can see if that's something you can apply in your practice. Your practice could be the community setting, could be the hospital setting, and could also be the academia. So it has been intentionally designed for you to know whether you, for anybody on whatever level. So even if you have never had any experience with teaching, or you are an experienced individual in this field, I think you will find the information you will get from this, at least the first module, and I'm sure the subsequent one, that can help you, develop a common conceptual baseline. Next slide. Now, we have various modules that are coming up. Module 2 is the assessment. During this module, you'll be writing measurable learning objectives, again, using the Bloom's taxonomy that you've been introduced to in Module 1. And this, you'll be able to design quizzes, exams, and formative evaluations aligned with these objectives. So you'll be introduced to that. So Module 1 will set the pace for that. Then for Module 3, which is your active learning, there you will understand the adult learning theory and learning styles that was also introduced in Module 1. And this will provide rationale for active learning strategies introduced also in Module 1, allowing you to select engagement techniques intentionally rather than by, by preference alone. You will also see in Module 6, the micro lecture and teaching showcase, in that module. In this module, the teaching philosophy will outline that was outlined in Module 1 becomes a foundational element for the micro lecture delivered later in the program. You'll be able to revisit and refine these materials as evidenced by teaching growth and reflective practice. So you're starting with Module 1, then you're going to go all the way down to the Module 6. Next slide. So let's look at the learning objectives. By the end of this module, participants will be able to describe teaching roles and career pathways in academic and clinical pharmacy settings. The participant will be able to explain faculty expectations as related, depending on which area of practice you're in, relating to the scholarship, service in academic pharmacy. Also, be able to apply principles of adult learning theory and learning styles to instructional planning. They'll be able to write measurable learning objectives and be able to draft a preliminary teaching philosophy statement. So this will be part of the assignments. After you all have listened to Module 1, these are the expectations in terms of what you should be able to do. Next slide. So looking at the competencies, the participant will be able to identify teaching roles across the didactic and experiential settings. We'll be able to again construct measurable learning objectives and then apply foundational educational theory to instructional design and develop foundational instructional documents, again referring to the teaching philosophy. Next slide. There are certain assignments that are required, and they've already been posted on the platform. And I think you'll be able to get a chance to see that. We have an article, which is an overview on the Bloom's taxonomy. And then we have short reading on different learning and professions, educational articles that you all can read that is also posted. And we have something in there that is it's a reflection assignment, and it should just be one page. And I love the questions that we have in there because it really gets you to start thinking about why you're actually taking this teaching certificate. And one of them is, why do you want to teach? Is teaching a passion for you? What exactly draws you to teaching? It gives you that moment to really reflect. So I think that would be a good one that really. And then the other second point that I like that we have in there is that he asks you a question, which is for you to describe what teaching currently looks like for you. Let's say you are a clinician practicing in a hospital, and your teaching that you do is to precept and mentor maybe students or residents. He asks you that question as to, okay, what does it really look like for you? Or you may be somebody that is new wanting to get into this field. he also asked you that question. So I think that reflection assignment is definitely something I think is really good to know. Then he will ask you. Then the third assignment is to draft learning objectives, and we're requesting that you draft like 2 or 3 learning objectives for a topic that you might teach in any setting. Next slide. So these are the topics that we're going to cover in this module 1. Overview of teaching roles in pharmacy education. 2, career pathways in pharmacy, academic pharmacy, and clinical teaching. I think you're going to find that really very informational. Introduction to academic pharmacy, learning styles and the implications for the instruction, then the Bloom's taxonomy and writing measurable learning objectives, teaching philosophy development, course and syllabus development, and then alignment of objectives, learning activities, and assessments. So these are the topics that we're going to cover through the module 1 today. I'm trying to get this out of my way here. I think. Okay, that's it's okay. So if we look at teaching roles in pharmacy, you have a didactic instructor. The didactic instructors they're responsible for classroom-based teaching in colleges and schools of pharmacy. Okay, thank you. Somebody got it out of my way. I appreciate that. And what are the key responsibilities for these didactic instructors? So I'm sure we have some didactic instructors here on this call. And it may differ from maybe country to country, but it'd be interesting to learn. And that's why I enjoy doing what I do, because you get the opportunity to hear what other people are doing. And it's, it allows that information exchange. So key responsibilities include they design course content that is aligned with the curricular outcomes. They write, again, which is what we're going to discuss during this 2 hours today. They write measurable learning objectives. They deliver lectures. It could be in a face-to-face, it could be a hybrid combination of virtual, face-to-face, or online formats. They develop and grade assignments. The assignments could be quizzes. It could be exams. It could be, different assignments that is related to what they have, taught. They provide feedback to support learner progression. Now, the one good thing too that will come out of this is that for those clinicians that are also in this teaching environment but are preceptive residents, you will find that a lot of what is needed for preceptors when you teach students, it has to be that you need to give feedback. It's, progressively, so you will get an opportunity to do that. Didactic instructors must balance contact expertise with instructional design, ensuring that material is appropriately leveled for the learners. And the learners could be your pharmacy students or could be residents, and aligned with accreditation standards. Next slide. Experiential educator and preceptor. This is where I spend most of I did a lot in this area, because I'm a specialist in critical care and nutrition support. I also moved up at the management level, whereby I became the residency program director in my institution. And I had I have 4 residents, that I was that I was in charge for the residency program. Then as a specialist in metabolic support, I also ran a metabolic support service. So I had the multidisciplinary team whereby I had the physicians, dietitians, the nurses, and the pharmacists as part of my team. So in this, as the experiential educator and preceptor, I also had students from pharmacy schools that came to my site, to do their rotations, their experiential rotation. And that is something that I really would be very interested to know. What are we actually doing in Africa when it comes to these experiential rotations for our pharmacy students? At what point are we doing that? All right. So the experiential educator, who is also a preceptor, depending on what you want to call them, often, like I said, is referred as preceptors here in US. They teach learners. Learners are your students or your residents in practice-based settings. So the practice-based settings could be your hospital. It could be your pharmacy, your community pharmacy, such as hospitals, or it could be ambulatory clinics, community pharmacies, like I mentioned, or specialized clinical sites. For example, now I am in a specialized clinic, specialized HIV clinic, whereby we see HIV patients. But then I also have students that come to that site, and I'm their preceptor. But I also work with a medical doctor, so that medical doctor also is, quote unquote, also a preceptor for the students, So any of this, in any of these settings, you can be a preceptor for the student. So what does this look like in this setting? Well, the role emphasizing coaching. You do a lot of coaching. You do a lot of mentoring in terms of the students, but you're doing it in real world patient care environment, all right? You also, while you're doing all this coaching and mentoring, you are assessing performance through observation and application. For example, you can see the student do something good, you can make sure you give them that feedback, and if they do something that you feel like needs to be improved upon, you can also do that. So application comes in. And you integrate learners as pharmacy extenders. What does that mean? That means your students are involved in what you do. And that's something I do a lot with my students. So like I do a lot of medication, counseling, a lot of drug information questions. So everything you do, your students are part of it. So that's where they are part of that. You use them as pharmacy extenders, if you, in terms of the prescription, of course, with observation, with you observing them, and then you give them feedback. So you tend to then give informative, you give formative and summative feedback. And at the end, if they are with you for like 5 weeks, you want to make sure that midpoint, you give them a midpoint evaluation. And then, of course, at the end of their 5 weeks, or whatever number of time they're with you, you make sure you give them the final evaluation. So, unlike didactic teaching, experiential education relies heavily on situated learning, also provides judgment and individualized coaching. Coaching is a big word here, involving them in what you do. So they observe you. They do what you do. And that is where the learner decides, oh, is this something I really want to do? Do I really want to be like this preceptor? Do I want to be a clinical pharmacy specialist, or do I want to be an oncology pharmacist? So that is their opportunity to really see and then decide where they want to go from there. So many pharmacists actually begin their teaching careers as preceptors, making this role a very critical entry point into pharmacy education. Next slide. Now, the clinical educator. The clinical educator often bridge practice and teaching, combining patient care responsibilities with structured educational activities. This role may exist within academic medical centers, health centers, or faculty practice models. Clinical educators, commonly, they supervise learners, again, which are students or residents, doing patient care activities. They facilitate case-based discussions. They model clinical decision-making and professionalism, and they integrate evidence-based medicine into daily practice. This role requires balancing the service demands with educational responsibilities, and offers a platform for teaching applied clinical reasoning. So I know here in US, some of the clinical educators, and that may be something too that I would like to pose a question and see, they have the opportunity to have a practice site. Their practice site could be in an institution. Their practice site could also even be in a community pharmacy. Why is this important? This is important because it gives that professor the opportunity to see what is actually happening in practice, and they can also integrate it into where the teaching part. So this is probably a discussion point that one can look at in future. Next slide. Now, the adjunct versus full-time faculty. Somebody like me, I was not a full-time faculty member. In other words, I was not employed by the institution. I was employed by I was not employed by the academic institution. I was employed by my hospital. So that's the hospital that paid my salary and everything. But I had affiliation with the pharmacy school. Actually, I have affiliations with a lot of pharmacy schools as adjunct, professor, some to even extent, even associate, versus a full-time faculty person, professor, that is paid by the school, but then had affiliation with my institution. And what kind of affiliation? My institution was a practice site for them. That's where they bring their students to see the practical aspect of what's going on there. So there is a difference between these two. Now, so the adjunct faculty, typically, they teach selected lectures, courses, or labs. So as an adjunct faculty member, I was invited as guest lecturer to teach in my area of practice, which is nutrition support, critical care. They can participate, and maintain primary roles in clinical practice. That's my primary role, all right? They can also focus on teaching with limited service or scholarship expectations. And I was able to do some projects, research projects, collaboration with the full-time, faculty member. The full-time faculty, commonly, they hold defined teaching, scholarship, and service responsibilities to the school. They participate in curricular planning and assessment. They engage in professional development, research, or educational scholarship. They also serve on committees and contribute to institutional governance. You all heard a lot about Dr. White's background. Yes, she was fully academic, but I had the opportunity to meet her when she started working with me in my institution in her field. So again, that collaboration. And why am I spending a lot of time on this? Because I think these may be things that in Africa, we may want to look at to see how do we strengthen that collaboration between our practice area, whether it's healthcare, the hospital, whether it's community, whether it's clinic, and the academic institutions. So I think understanding the distinctions between these roles helps faculty to align their expectations, their workload, and professional development strategies. Next slide. I think I mentioned a little bit too about guest lecturing and small group facilitation. For example, after you all go through this teaching certificate program, there may be opportunity for clinicians to be invited as guest lecturers in your specialty area to the academic institution. So what typically happens in this kind of setting? So guest lecturing and small group facilities are often, and sometimes for people who are trying to decide what they need to do, they are good entry-level teaching opportunities for pharmacists new to education, all right? Now, this role may include delivering a single or limited number of lectures, facilitating active learning sessions, lab activities or workshops, leading case discussions. And from leading case discussions, you may say, oh, well, maybe this case discussion will be a good one that you could try to see if you could do some publication, or breakout groups, and participating in team-based or problem-based learning sessions. So although limited in scope, these experiences are valuable to building teaching confidence. It can help people to, if after you've done it a while, you get more confident in terms of delivering this kind of presentations, and also to receiving feedback from learners and faculty, and also to developing materials for a teaching portfolio, and also exploring interest in expanded teaching roles. So I think guest lecturing and small group facilitation is also something that can also be very valuable. Next slide. The clinical faculty, they typically combine teaching responsibilities with direct patient care. And that was where I explained that my relationship with a lot of the people who are involved in this teaching certificate program started from my role as a clinical pharmacy manager, residency program director, and specialist in my institution, and working with them that had full-time positions at the school. And actually what they did, like I mentioned, is that they chose my site as practice site. And another innovative thing I did that I think I would like to share is, as a residency program director, I had limited resources to have my program the way I needed to have it. What it is, as in a residency program, you need to have preceptors that are specialists in the particular learning modules you'll be teaching your residents. In my institution, I only had like about 3 specialists, myself included. I was a specialist in critical care and metabolic support. Then I had a specialist in pharmacokinetics and cardiology, but I needed specialists in pharmacovigilance, in internal medicine and all that. What I did, I partnered with the pharmacy school, with the college. I said, okay, you all have specialists in these fields that I need. I need them to be preceptors in my residency program. But I also know you all want a practice site for your professors. You can use my practice site for your professors. So it became a win-win situation for both parties. So they used my practice site to really train their students to be involved in what's going on practice-wise, that helped them in their teaching portfolio of the students. And at the same time, they had the opportunity to be preceptors for my residents. So this is something that I would have had to pay specialists, hire them to be part of that. I ended up not paying. So the school gained and I gained. So I really wanted to share that, because I'm hoping that after you all go through all this program, some of the ideas and things we're going to share, you'll be able to apply them. So the clinical faculty, the key features of clinical faculty includes they teach in didactic courses, skill labs, and experiential settings. They precept students and residents, which is what I just described. They will have to have a practice side. They maintain an active clinical practice. They contribute to practice-based scholarship, quality improvement, or case reports, and they serve as role models for clinical decision-making and professionalism. So the clinical faculty positions, they appeal to pharmacists who value continued patient care while contributing to the education and professional development of future pharmacists. Next slide. You also can have the research-focused faculty, somebody who is totally focused on research. They concentrate on scholarship and grant-funded research, often within pharmaceutical sciences, outcomes research. They may do things for like major pharmaceutical companies, health services research, or educational research, you know. Their common responsibilities include they develop and sustain focused research program. They secure external funding. So they're looking at grants. And this is also another area for us to look at. It's not just with people who are in, academic setting or hospital or the community, even the college, to look at how can we get what is out there to tap into grant-wise to help us in terms of where we need to go. They publish in peer-reviewed journals. They mentor graduate students, residents, and fellows, and they also teach selected courses or guest lectures related to their expertise. So although teaching expectations may be lower than with the other tracks, research-focused faculty must still demonstrate instructional competency and contribute meaningfully to learner education. Next slide. Then you also have the teaching intensive faculty. Primary focus for them is student instruction and curricular delivery. So they teach multiple courses or course components. They develop instructional materials, assessment, and active learning activities. They coordinate courses or serve as block leaders, and of course participate in curricular assessment and continuous quality improvement, and they engage in educational scholarship or teaching innovations. This pathway is well suited for educators who are passionate about student engagement, instructional design, and teaching excellence. Next slide. You also have the administrative leadership roles. And in fact, and Dr. White moved through that role. She'll talk about that. You all heard that she was interim dean, and so that's administrative. And then Dr. Pamela Moyo, he's also one of the facilitators, speakers here during this module, was also in this, but right now she's the chairman, the clinical pharmacy department chairman. So a lot of clinicians you can see move through this. This one allows faculty to assume leadership positions within academic institutions, often while maintaining some level of teaching or scholarship. Now, the examples include, they could be course coordinator or program director, they could be experiential education director, they could be department chair or associate dean, and they could be assistant or / associate dean for academic affairs. Like I had that role in one of the institutions also. And these roles, they require strategic planning and decision-making, faculty and learner mentorship. They also have to be very knowledgeable about the accreditation standards and also balancing institutional priorities and education mission. But even if you're in this role, it still helps. Like with me, you still have to have your hands in, because to kind of keep abreast of what's going on. Like right now, I'm working with one of the people who's in a role like this, trying to see how I can bring them into one of my practice sites, because I have 2 practice sites, the HIV clinic practice sites, with all the new changes that is coming up with HIV in terms of pharmacists' role expanding, all right, to doing the testing, to doing, providing the PrEP and PEP, be able to dispense and to authorize medications for the HIV patients. So there are a lot of things going on that this individual that is in the administrative role, we're looking at, okay, how can I bring that person in and let's work together to kind of see how can we expand the pharmacy services there. So these are things that one could kind of be thinking about, innovative things that you can do with this type of information you get. Next slide. It's very important to balance practice and academia. I think I mentioned that. To me, I think one can be in a situation where you're doing more of this, but you should also have the opportunity to see what's going on in the practice area. Because a professor who has an appreciation for what's going on in the practice area, it can really help with the way they deliver, they deliver information to the students and so on and so forth. So many pharmacy educators, they try to balance academic responsibilities with ongoing clinical or professional practice, particularly in clinical faculty and adjunct roles. Effective balance may include clear role, making sure you know clearly what's your role in the academia and then also in the practice, and then have protected teaching time. And that's what I had to do with the professors that were using my site as practice site. There was constant communication. They had to really come up with a way to balance their time and be effective in both. And it worked out. Alignment between clinical practice and teaching focus. Efficient integration of teaching into practice settings. That's a key. And ongoing professional development in both domains. So balancing the practice and academia allows educators to bring current real-world experience into the classroom while maintaining professional identity and expertise. Next slide. Teaching. Teaching is a core responsibility across most academic pharmacy roles, and also can encompass, instruction in both didactic and experiential settings. Teaching expectations may include classroom instructions, doing the lectures, the labs, the seminars, experiential education and precepting, assessment of learner performance, curriculum development and refinement, and providing feedback and mentoring to learners. And that's something I really like any opportunity I have. I like to make sure that I mention this, that we clinicians who are out there, let's continue to remember that our role is to mentor the young ones, the professionals, the ones who are coming up. Is what they see of us is what makes them want to say, okay, this is the way I'm going to go with pharmacy practice. And that's how we ensure that we keep our pharmacy practice alive. That's how we ensure that we continue to move that pharmacy profession to the level it needs to go. So I always like to seize that opportunity to say that. And if they see we're passionate and we like what we're doing, then they get more encouraged to want to be able to do that. So effective teaching requires intentional design, alignment of learning objectives and assessments, and responsiveness to diverse learning needs. Faculty are expected to continuously reflect on and improve their instructional practice. And it's not a bad idea to ask your students also what their opinion is, because they are the ones on the receiving end. So these are the things I think that we all need to consistently think of too. Next slide. I think I'll get into this last. Scholarship involves the generation, dissemination, and application of knowledge. The nature and extent of scholarship expectations vary by faculty track. So you have different examples of scholarship out there. It may include practice-based research or quality improvement projects. Like I know I do a lot of different projects and with the faculty members, educational research and teaching innovation. Like we even have ideas of how can we collaborate with people who are in Africa, to kind of do research together and so on and so forth. Peer-reviewed publications and presentations. This group that I'm talking about, the GPDSA, those are the things that we're looking at. How do we collaborate? How do we work together to be able to do all this? Grant writing and funded research. I mentioned that, how important that is. That will definitely help to sustain a lot of the initiatives and professional contributions that advance pharmacy education and practice. The goal is, how do we continue to advance pharmacy practice? What do we do to ensure that? Even in teaching focused roles, scholarly engagement often supports instructional effectiveness and professional advancement. Next slide. The service. Service includes contributions to the institution, the profession, and the broader community. Service responsibility must involve serving on departmental, college, or university committees. That as a clinician, that's where you have the opportunity to do your advocacy component. Let people know, educate people about pharmacy, educate people about the advancement of pharmacy. So participating in accreditation or assessment activities, leadership in professional organizations, that's another area. Community engagement or outreach, that is a big one. And mentorship of students, residents, or junior faculty. So service is also something we definitely need to pay care attention to. And service reflects professional engagement and supports the mission and governance of academic institutions. Next slide. Promotion and tenure. Promotion and tenure processes they evaluate faculty performance over time based on established criteria in teaching, scholarship, and service. And it may be different in your institution, maybe different country to country. Awareness includes understanding. So appointment type usually is tenure track versus non-tenure track, expectations for advancement at each rank, and then required documentation, things you have to have. Like, for example, I've been fortunate and blessed to have had the opportunity of working with some of the professors, when they just started. A lot of the work they did with me globally, especially in Nigeria, was used, what helped them to be able to move up to the professor level, because they had them all in their portfolios, all the things like the first international pharmacotherapy workshop that was done in Nigeria. Two of the speakers on this program were with me, and that's how they moved. A lot of other things. And one of them ended up coming with me to Nigeria 7 times. And all those things were in her portfolio. And that's how she was able to move to the professor level. So these are all the things that one should kind of think of. So while not all participants would pursue the tenure track roles, understanding promotion pathways support informed career planning and professional development. Next slide. So I think Dr. White will take over from here. This is the last slide I will share. So the adult learning theory, this provides a framework for understanding how adult learners engage with and apply new knowledge, which is central to pharmacy education. So adult learners, they typically are goal-oriented and internally motivated. Yeah, and I think so. I really do believe that. They prefer learning that is practical and relevant, and they bring prior knowledge and experience to the learning environment. They value respect, autonomy, and collaboration. So it's good to at least have an idea of the population you're dealing with. You know, for example, the international pharmacy practice residency program that is now done, that is under WAPCP, that WAPCP is actually sponsoring the pilot in one of the institutions in Nigeria. A lot of them are adults. In other words, they're pharmacists who have been practicing, and you can see the difference between them and the residency program that we have here in US, whereby once they get out of school in their 4th year, they start, they start applying for the residency programs they're going to go. So as soon as they finish that 4 years PharmD program, they get into the residency. So there's a difference between that group and the ones who have already been practicing, who are pharmacists. You know, all these points that I mentioned, you see it, you know. They prefer learning that is practical, relevant, and so I think it's something definitely to note. Next slide. I think the next slide is you, Dr. White.
Yes, it is. And thank you so much, Dr. Pounds. I'm happy to be here today.
Yes.
To continue our session. And so Dr. Pounds has shared on some of these foundational concepts. And I think you pointed out something really important earlier, the why of teaching. Right. And so having a passion for teaching. I love the quote that the teaching is the gift that keeps on giving. Because when you share knowledge with someone, when you impart that information to someone, we know that it's going to go far beyond the classroom and truly impact patients, impact lives. And so I always challenge students to think about your impact, and that when you are sharing with someone, when you are imparting knowledge, that it's going to go way farther than those individuals, and that it's truly going to bless many, many people. So with that, I'm going to continue in discussing adult learning theory. And you all, if you click on the resources button on the platform, there are a couple of reading materials on adult learning theory. So if you want more information, there's a lot of literature on this, and it being a foundation really for everything that we do. So take a look at that adult learning theory reading attachment when you have a chance to. So self-direction, and I'm going to ask you all to pause for a minute and think about your own experiences as adult learners. We know you all are goal-oriented, that you're driven by relevance, by impact. So think about the people that you will be teaching in terms of how they are going to be wanting to learn. We know that adult learners prefer to take ownership of their learning, that they make decisions, they want to be actively participating in their decision making, and then reflective. There'll be quite a few reflection activities in this session. But we want to always keep in mind when we're teaching that we want to take that time to pause and reflect. Even if you think about your own learning and how you have sat through lectures, of course, when you're reflective, when you're thinking about problem solving, when you're discussing, oftentimes that helps you to retain the information more, and of course, to apply it to when you teach. So the key takeaway here, adults learn best when they're actively involved. So when you are teaching and designing lectures, be sure to incorporate some type of active learning into your sessions. So experience as a learning resource. And I know that you all have experience in thinking about how can you bring that experience into the classroom. Many of us have practiced in different settings, different pharmacy settings, interacted with patients, interacted with other healthcare professionals. It'll really help that as you're designing those lectures and sessions, that you bring some of that into the classroom to the best of your ability, whether it be through clinical exposure, with your students, sharing your personal insights, or sharing your different perspectives, or having the students in the class to share their perspectives. For example, you might bring in a case discussion in your classroom where you are sharing on a patient problem that you've worked through with a team, and then have your class to be creative and integrate their experience into that case. And so thinking outside the box in terms of how do I bring my experience into the classroom to help learners have additional resources would be very helpful. And then next is learning styles. So think about, again, how you learn. You've probably heard of these learning styles. There are visual learners, there are auditory learners, and then kinesthetic learners. And do you have a preference? Most people enjoy a combination of these styles rather than one, but you have to kind of think about all three when you are teaching, because you probably will have a mix in the classroom. So you don't want to focus on just one in terms of your teaching method. You want to make sure that you've incorporated a little bit of each of these when you are teaching. And we suggest some teaching strategies here. So in terms of bringing all of those learner styles together, the visual, the kinesthetic, as well as other types of learners, bringing those approaches together with visual aids and structured slides will be helpful. And then adding that to, again, active learning activities, cases, simulations, practice exercises, a good combination will be very helpful to your learners. So just the key takeaway here, there's no one size fits all in terms of your teaching method. If you teach with just one method, let's say that you only lecture, you're probably going to have some learners that are going to struggle a bit. But if you use a mix of strategies, again, tapping into those visual learners as well as kinesthetic learners, then you'll be much more successful and effective in delivering your information. And also just thinking about how people learn may be different from how you best learn. And so I asked you earlier to think about, what's your preference? Are you more of a visual learner? Are you more of a kinesthetic learner, or a auditory learner? That might be different than, of course, the students that you're teaching. And so if you're aiming to boost their confidence, their understanding, and their engagement, you really want to think about, how can I combine all of these styles in some manner, sprinkle them throughout your lecture. That way you're touching on some of the different preferences of those who are receiving the information that you're sharing. So with mention of reflection, this is a good time for you all to be thinking about reflecting in this course. There is an activity that is posted on the platform, and it's under the study materials section. After we complete this session, if you will, click on that and upload your responses. The question there asks you, how do you learn best? And then how might your learners differ from you? And we'd love to hear you to share on your learning preferences, and then your thoughts on how you might integrate some of these other styles into the way that you'll teach in the future. So please upload that. We'll be reviewing those over the next couple of weeks, and we can't wait to hear from you all to hear what your preferences are. All right, so Bloom's taxonomy. You'll hear this many times in teaching. It really is a guiding framework to classifying learning outcomes and then helping students to move. We'll go over the pyramid next, but to the top of that pyramid in terms of application. I think it's great to be thinking about this as you're designing a session, as you are thinking about the goals of your session. What do you want the key takeaways to be? There's that old phrase, begin with the end in mind. So thinking about when that student finishes your course or your session, what do you want them to be able to demonstrate? And the 6 levels are here: remember, recall facts or basic concepts, understand by explaining ideas or concepts. Then we want to move to applying, and then analyzing and evaluating. And then finally, at the end, we hope that the learners could generate new ideas or plans. So here's just a quick visual for visual learners of Bloom's taxonomy. Now remember, we start here at the bottom. If you think about even in your own training, oftentimes when you start, it's more about memorization, recall, trying to remember and repeat certain items that you've learned. But the goal is to eventually move up this pyramid to understanding and then applying. Dr. Pounds talked about the experiential teaching phase when you're out in your clinical settings and you're practicing more at the top of this taxonomy. But we know that with our training, most of us start down here at the bottom with recall. So as a future teacher, we always want to be keeping this in mind, that where we at in sharing with our students, depending on the group that you're sharing with, where should you start, and where would you like to finish by the end of training. And so being very mindful about this early on will help you to design those learning objectives. It'll help you to move in a very structured way so that you're intentional about meeting the goals of your particular teaching session. All right, so what are some measurable learning objectives? And as I mentioned, our goal is to move beyond that memorization phase to more of a application and then creating phase. So if you like learning objectives, or you've had some practice writing learning objectives, high five. If you haven't, you will get some practice here. That second worksheet is all about writing learning objectives. So you're really answering the question, what should the learner be able to do? It's not about what will you teach, but what will they demonstrate at the end of your teaching to really show that you've been effective and that you've reached your goals. We're going to use Bloom's taxonomy throughout these sessions, and those will really help you in terms of action verbs and in writing your learning objectives. So here's a simple structure to be thinking about as you get ready to construct those learning objectives. Answering the who, what, and how. And you can think of those in terms of the learner, the action, and the context. And so the who is usually your learners. It's usually implied as your learners. The what, that's the action or the Bloom's taxonomy verb. And then the how to, that's where we're going to start thinking about the actual context of what we want to teach. And so here's an example here. At the conclusion of this section, learners will be able to apply clinical guidelines to select appropriate antihypertensive therapy for a given patient case. And if you think about this example, what do you think would be key here in terms of your verb, your Bloom's taxonomy verb? If you said apply, yes, you are correct. That will be your Bloom's level verb here in this example. And then the clinical guidelines, that will be your knowledge base if we're thinking about the who, what, how method. And then the select therapy for a given patient case, that will be our context. So as you are thinking about your development of learning objectives, always be knowledgeable about who you are targeting with the learning, what is that observable action you'd like to see, and then how or to what level. Give some context there. Now, my next question is, could you actually assess this? And of course, the answer is yes. You could maybe give a case. We've already indicated in this example that you could give a case, or maybe evaluate their decision making. So that's going to be our next level of thinking, is once we create learning objectives, how can we assess those learning objectives and making sure it is something that you can assess. That's one way to kind of test your learning objective to see if it needs to be refined. All right, so here's just some examples of action verbs. You know, sometimes they come to us pretty fast in terms of what verbs we want to use in a learning objective, but sometimes you kind of need some time to think about, well, what exactly do I want to measure here? What am I targeting? Remember that these first couple ones on the left, those are at the bottom of the pyramid. So back to that memorization, recalling, but we want to move up to the top of the pyramid, right? So as we progress, we want to focus more on knowledge and comprehension, and then move a little bit higher to deeper learning, your analyze, your evaluate, and your create. So there are many, many verbs that can be used. These are just a couple examples, and some of you can try to test these out in that worksheet activity. All right, so alignment. We've talked about the importance of Bloom's taxonomy and choosing the right verbs, but it brings us to one of the most important things today, and that is aligning all of these across the development of objectives, activities, and assessments. And so Bloom's taxonomy will, of course, serve as our guide in thinking about, well, did I start at the bottom of the pyramid and then move to the top by the time I've ended my session? We'll start with those lower level objectives, which remember were more memorization, recall. So that could be with a quiz. As you know, oftentimes a quiz is short answers, multiple choice, and you are trying to recall. But then we want to challenge a little bit more in terms of deeper thinking with maybe a case or a problem solving activity. So you want to include that at some point. And then again, as you move up that pyramid, higher level objectives. Now we're moving up to the apply level. And so maybe you are giving some type of clinical evaluation at that level because you've expected that student to now apply what they've learned beyond a quiz. And then lastly, well-aligned instruction definitely would include learner engagement and retention. So being very intentional, again, you know, I mentioned earlier about beginning with the end in mind. Where do you want the student to be at the end of your teaching? And thinking about these different levels that you can help them to progress to. All right, so as you are working on these learning objectives and practice, we're going to give you a chance to write your own learning objectives, and then we'll look over them and give you feedback. Be sure to think about the Bloom's taxonomy pyramid and where you want to start with your learning objective. Maybe you write 2 or 3 or 4 down, and maybe that first one is at the bottom of the pyramid, and then eventually you move up higher. And so when you have a chance, take some time to click on that worksheet 1 and share with us on some of your ideas of learning objectives. We can't wait to look at those. All right, so as you work on practicing those learning objectives, we also want you to be thinking about back to that why and your teaching philosophy. I think a teaching philosophy is something that we'll all develop over time. And in this course, you'll write your own teaching philosophy throughout the course. So you'll start with this module, and then with some of the other modules, we'll ask you to go back and revisit it. But keep in mind, teaching philosophies evolve over time. And so you might write one this summer, and then next year, your teaching philosophy might change a little bit. It really is a time for you to reflect and to think about your beliefs, your values, your approach to teaching and learning. All of us are different in how we've been trained. And so we're all going to have a different way that we teach and share with others. But it does require you to think about what you believe about learning, how you view your learners, and then how do those beliefs show up in your teaching. And so, again, just think about your own way of teaching and what shaped you over the years. Maybe it was somebody that really had a great impact on you. They taught in a way that you really received. And so that might impact how you teach. Or it could be the opposite. It could be somebody that was a really bad teacher. So you became a little frustrated and learned from what not to do. Or it could be something from your clinical training or what you do in practice that you really gravitated toward and said, you know what, I really like the way this was shared or delivered. It really had an impact on me. And so that teaching philosophy, all of those experiences in your life will pour into what your own teaching philosophy looks like. And it'll be important for you to, again, take the time to really reflect and think on what your teaching philosophy should look like, because you'll use it in things like teaching portfolios by the end of this course and this program. You'll have a whole teaching portfolio. This will be a main component for it. It'll help with job applications. Oftentimes we'll ask new faculty, what does your teaching philosophy look like? Or sometimes we'll even ask them to provide a presentation on their teaching philosophy, because it tells us a lot about that individual and their approach to sharing with students and learners. And then, of course, if you ever want to apply for a teaching position, Dr. Pounds mentioned adjunct opportunities, opportunities to teach online and other programs. Oftentimes that is a component that is requested, that you share your teaching philosophy. So it'll really be helpful as you move forward to refine your teaching philosophy. Okay, and I think I've kind of mentioned why teaching development or teaching philosophy development matters. But instead of just kind of teaching and checking off a list, you become very intentional about your teaching. It'll align with what you do in practice, what you want to see. We've been talking about the future of pharmacy a lot and how it's evolving. So what do you want to see in the future of pharmacy? It'll allow you to contribute to that. And then, of course, it'll help you to become even better, because I mentioned that the teaching philosophy will evolve. So it'll help you to be a better teacher in the future. So key components of a teaching philosophy. A strong teaching philosophy, as I mentioned, includes your beliefs about teaching, answering questions like the purpose of pharmacy education, how do learners best acquire knowledge, skills, and behaviors, and then responsibilities that educators have to the profession. So back to that legacy and sharing what we've learned with others. Also, it includes the view of the learner. So we've talked about adult learning theory a little bit, and you'll be able to put your own perspective into how adult learners progress. And then how do you meet different learning needs? As we share with different students, we'll see a variety of needs over time from different learners. Some learners, of course, are very quick to pick up things. And then, of course, there are others where you have to really modify how you're teaching to make sure that they are getting those core components of what needs to be mastered. And so you definitely learned how to cater to different backgrounds and different learner experiences. Other components include instructional approaches that you'll use. We've talked about some today, but I've emphasized that you want to have a mix. So sprinkling in a little bit of active learning, a case discussion here or there, being creative about how you bring in different professionals to share in their real world experiences will be helpful. And then lastly, assessment and feedback. So making sure that you're intentional about how you're going to assess the individuals to make sure that they have met those learning objectives. When I'm designing items, I like to tie my end result back to the learning objective. So I want to see a direct arrow that shows me, okay, this is how I know that this learner has truly completed and met this achievement or this learning objective. And again, that kind of takes some thought on the front end to make sure that you have aligned your sessions properly. All righty, and then growth and reflection. I think we've talked about that a little bit in terms of how do you want to evaluate and improve your teaching over time, being very mindful about feedback from learners and peers, and then remaining current. You know, Dr. Pounds had mentioned a little bit about how we have to stay on top of things in this field, especially when you're teaching. There's so many changes and things happening within the profession. So part of course, your responsibility is to stay on top of everything that's happening and to best share that with your students. And as we've been talking about, students bring their own experiences into the classroom. So you don't have to be the only one who is staying on top of things and being remaining current. In one of my courses, I have the students to bring in news stories and topics that they have seen recently. So they are also staying current and also helping their peers. I know later on we'll talk about peer-to-peer teaching, but that is another way to integrate ways to remain current. All right, so teaching philosophy as a living document. I added this here because the teaching philosophy, as I mentioned, will evolve. It's not a static item that you write it now and that philosophy sticks with you forever. It should evolve as you gain experience, as you receive feedback, again, as we stay current and new instructional strategies come out. We know that even with artificial intelligence being integrated into teaching, so many things are changing. And so your teaching philosophy will also change too. And as I mentioned, we'll give you that opportunity to write it and revise it and hopefully have somewhat of a final version by the end of the program. So assessment and application, if you will, click on worksheet 2 in the resources section under study materials. That's the second activity for this session. And we want you to start thinking about what your teaching philosophy will look like. There's some questions in there to get you thinking about your beliefs, your values, your approach to teaching. We will take a look at that teaching philosophy and give you feedback. And then in a later session, some of the other faculty in the program will continue to help you to refine your teaching philosophy. I can't wait to see what you all share in terms of your personal teaching philosophy. All right, so let's just shift a little bit to discussing the syllabus. We've talked about teaching philosophies, we've talked about adult learning theory, and we've talked about learning objectives. And so for this final topic, I just want to share on some of the foundational elements of developing a good syllabus. Now, at quick glance, the syllabus might just seem like another document for learners to look through on a site, but really, I think it plays a much bigger role A syllabus really does guide, and some people will even call it a contract between you and your learners. And some people have said, oh, wow, you call a syllabus a contract. But if you think about it, it is a contract in a sense, because it sets clear expectations for what your learners will do, how they will be evaluated, and then how the course will function. And so a syllabus is a really important document to guide the class. When I'm teaching courses, if I make major changes to my syllabus mid-course, I usually apologize to the students, to the learners, because I'm asking them to understand my expectations for their performance and their engagement in the course. So I want to be as clear as possible at the beginning of the course, so that they really have a good guide and they really are understanding of how to navigate the course. So you really want to spend a little bit of time thinking about, have I added all that I need to add to the syllabus to guide the class and to make sure that they are clear? And if I haven't, then of course you want to take that time to go back and make sure your syllabus is refined and ready to guide the class. So principles of effective course syllabus design, back to those learning objectives, being very specific about what you'd like to share throughout the course, aligning those objectives with activities and assessments that will help you to truly reach the end goal on that Bloom's taxonomy pyramid, communicating transparently to learners, supporting learner accountability and engagement, and then reflecting on those principles of adult learning will be important too. So a didactic course syllabus, and Dr. Pounds talked a little bit about didactic versus experiential, but didactic courses are typically delivered in the classroom, in a lab or in online formats, a little bit more structured, as was mentioned before. Now, key features of a didactic syllabus, you want to definitely have the course title, description, and prereqs noted, learning objectives, of course, your course schedule, and assessment methods, grading policies should be mentioned there, and then policies related to attendance, etc. We recently had to add some items related to artificial intelligence to one of our courses. We had quite a few students asking, could they use AI in a course that we're teaching? And we weren't quite sure at first. And so there wasn't anything in the syllabus regarding AI. And so we couldn't really hold the students accountable because we hadn't mentioned artificial intelligence. And now everybody has come to a consensus on requirements for AI use, and we have just released it last month. We released a statement in every syllabus. The same statement is written regarding AI use. So it's important, again, to just kind of deliver those expectations to the students up front, because you can't really hold your learners accountable to certain things if you haven't added those mentions in that syllabus. The other type of syllabus is your experiential syllabus, a little bit different than the didactic syllabus. So in those clinical settings, practice-based settings, rotations, we're focusing on application, professional behaviors, and of course, real-world performance. And so our features in the syllabus will be a little bit different. We'll add in descriptions of the practice site, the patient population that the learner would be working with. We'd also add in experiential learning objectives, which might be a little bit different than the didactic learning objectives. Oftentimes those experiential objectives are competency-based and also aligned to experiential type accreditation standards. And so we want to be mindful of that. But then similar to didactic, we have our expectations of learners in the experiential syllabus, the schedule or outline, and then the methods of evaluation, which we know might be a little bit different than the didactic syllabus. Maybe you add in something related to direct observation or a midpoint and final exam versus more quiz-oriented type assessments that you might see in a didactic syllabus. So just thinking about, as you are thinking about your own experiences, what have been some of your experiences in courses that you have taken or syllabi that you have reviewed? You know, I always like to reflect on, well, what do I already know about syllabi? And you've probably seen variation. And so as you begin to create your own, because remember, that's one of the activities in this session and in this program, what would you like to add to your syllabus when you do begin to teach your courses? Okay, so as we wrap up, I talked a little bit about alignment earlier, but as we talked about learning objectives, we've talked about activities, and then the last piece being the assessment. It's so important that we have intentional alignment and that we think about these things in advance, again, in the design of your lectures. And so think about this. Have you ever taken a test that didn't quite match what was taught? And the answer is probably yes. I've taught this to some learners before who have told me, you know what, that test I just took in that course, it didn't really match up with what was taught in the course. And so when that happens, usually it's an alignment issue. Usually you can go back to thinking about how was the learning objective tied to the activity and then tied to the assessment. And so we want to make sure that's not us in terms of what we teach and then what we test on. And one way to do that is to start to think about the alignment triad. And so the first part of that triad is the learning objectives, which we've talked about quite a bit. We want them to be learner-centered, measurable and observable, and map back to that Bloom's taxonomy. So we're not teaching at the top of that pyramid when we haven't introduced topics that have covered the bottom of that pyramid. The second part of the triad are learning activities. And so what are the activities that you want to use in your session to make sure that learners achieve the objectives? We've shared on a lot of examples, lectures, readings, case-based learning. If it's more experiential, maybe it's patient care experiences. The third part of the triad is assessments. And so assessments can be formative, which are very low stakes, feedback focused. Maybe it's a quiz. It's something that is very quick, a check-in, self-assessments, or they can be summative. So performance focused, higher stakes. Maybe it is a final exam, or in this case, maybe it's that you have to do a practice teaching session where you are in front of a group of learners and then they have to assess you. And so here's an example with regard to that earlier item that I shared on applying clinical guidelines. So if our learning objective was to apply clinical guidelines to select appropriate antihypertensive therapy for a patient case, what kinds of activities could we use to align with that learning objective? Maybe it is a small group case discussion. Maybe it's a clinical scenario that we present and we ask for problem solving ideas. And then what would that assessment look like? It may involve a written patient care plan or an essay question that you tie to it. So again, just aligning that objective with that activity and that assessment should really help in terms of moving up that Bloom's taxonomy pyramid. So moving from just asking someone to remember and understand to more of a demonstration and a practical application. It should help us to move through those different levels. So Bloom's taxonomy, think about it as you think about your learning experiences over time. What level are most of your learning experiences right now? Are you remembering, understanding, applying, or analyzing, evaluating? And then having a goal to get to that create piece at the end would really be great. But think about how you even move through Bloom's taxonomy. That'll be a good start. And then, of course, as you begin to teach, it'll help you to connect to how your learners will also move through this taxonomy. All right, so we've covered some great teaching tips today. If we think about some of the key takeaways that were shared, academic pharmacy offers multiple career pathways. Dr. Pound shared on so many of the different areas you can go into, whether you have an administrative focus or a research focus or a teaching intensive focus. I've heard some faculty share that, you know what, I want to teach primarily and not really do a lot of research and administration. And so in our environment, we assign percentages. So you might be at 80% or a 90% teaching percentage versus a 50%. And then your other percentage would go towards your research area or your service area or your administrative area. So a typical faculty member might have a 50% teaching allocation, and then a 10% research allocation, and then a 20% service allocation, and so forth, till it adds up to 100%. And most faculty, they may shift. So a couple of years you might want to teach at 50%, and then maybe the next couple of years you want it to go up to 70%. We kind of check in each year with faculty to see where are your percentages across teaching, research, service, administration, and clinical, and then would you like to see a shift? So back to that teaching philosophy kind of evolving, your pharmacy career as an academic may also evolve. There could be some seasons where you want to teach more or to teach less, and I like that there's the flexibility there. The other key takeaway is that education may begin in one pathway and transition to another as opportunities and goals develop. And I emphasize that opportunities. We've talked a lot about collaboration, and I know there are quite a few adjunct positions open where you could teach at different universities and contribute regarding bringing your experiences into the classroom. Another key takeaway is that understanding these components really helps you to intentionally plan your teaching development. And so we've talked about being intentional about aligning the learning objectives with the activities and then the assessments. We've talked about Bloom's taxonomy and it helping you to define the level of learning you expect from your learners, and that you have a goal to move beyond memorization to application and reasoning. And then we wrapped up with alignment and being very intentional on making sure you've mapped that learning objective to the activity and then to the assessment, because I think sometimes we forget about the last piece of how am I going to measure this? How am I going to assess this? And so thinking about that early on. And then lastly, your syllabus and your teaching philosophy. And so we've mentioned that you'll get some practice here in developing your teaching philosophy, and that we'll be very mindful about that syllabus being clear with expectations up front as a contract. All right, so next steps after this session, we'll ask that you will click on that resources button under study materials and be sure to complete worksheet number 1 and worksheet number 2, and then upload your responses. And then we'll get in there and we will definitely give you some feedback and correspond with you there, and that you will continue to reflect on learner engagement as well as your why in developing your teaching philosophy. Our upcoming concepts, active learning will be up next with Dr. Hill. I know she's looking forward to sharing with you all on how to bring very engaging concepts to the classroom, and be mindful to keep all of your portfolio items together. When we wrap up at the end, you'll have a nice set of artifacts as examples of your teaching. So keep them all in one folder or something as we go forward. And with that, I will pass it back to Dr. Pounds to wrap us up. Thank you.
Yeah, thank you, Dr. White. I think, okay,
Hello, any you?
yeah. So at this point, I guess we will open them up. We have a few more minutes.
Okay, and let me before that, I want to sincerely thank you, Dr. Pons and Dr. White, for that excellent and impactful presentation. Your key points were clearly communicated, and your examples help bring the topics to life. We appreciate your continuous contribution and efforts in advancing pharmacy education in West Africa. Before the time for question and contribution, I want to summarize the key areas covered, starting from teaching roles in pharmacy education, career pathway in academic pharmacy, faculty expectation, adult learning principles, Bloom's taxonomy, and learning objectives. We call it look at teaching philosophy development, course and syllabus development, sessional alignments, and today total participants are 100. I don't know whether there's a limit to the capacity of this meeting, but I know we're up to more than 100. But today on the call, we have 100 people in attendance. So now, for the next, we have about 15 minutes to go. The floor is now open for comments, contribution from the participants. Over to us. If you have a contribution, you can indicate by a raise of your digital hands.
Will you be monitoring is it by raise of hands? Is that how you're going to do it?
I'm trying to see where, maybe can we stop sharing our slides so that we can be able to monitor that?
Okay.
Yes.
Yeah, Dr. Bello.
Okay, Prof.
Hello.
Yes.
Yeah, thank you. Dr. Palms.
Yes.
And Dr. White, you've done a great job for us this morning stroke afternoon. And for the participants, let me really apologize. It was when I was trying to log in, I discovered that this platform has a limit of 100.
Oh, okay.
So, in fact, I couldn't join until after 20 minutes when somebody dropped off.
Okay.
So I'm sure more people were actually locked out of this meeting. So we sincerely apologize, and it will not happen again. We didn't know of this technical limitation, but we'll correct it before the next meeting, please.
All right.
But good thing, this presentation was recorded. So we'll share the recording at the end. Thank you.
Thank you.
Okay, thank you, Prof, for that one. Pharmacist Alpha, your hand is up. Can you please unmute and ask a question, please? Pharmacist Alpha, are you okay? Pharmacist Amatola, your hand is up. Can you unmute and ask a question?
All right, thank you very much, bro. I want to thank Dr. Pans and Mr. White for the presentation. My question is for adult learners, which from a clinical setting, we are likely to have more of them as mentees or as preceptors. How do you get to know their learning style? Do we need to roll out questionnaire at the beginning of the training, or how do you go about it? And then you've mentioned essentially 3 types of learners. How is this? How do we marry this with Cobb's learning styles? Cobb's learning styles. Thank you.
Dr. White, do you want to give that a chance? Go ahead.
Yes, great question. In terms of your question about how do you know a learner's learning style, depending on the number of learners you have, you could ask. You could ask if it's a small group and you're in an experiential setting, you're a preceptor, you could ask, how do you learn best? Is it by seeing, hearing, or doing? What helps you understand difficult material most? And learners will be happy to share with you, and then you can kind of customize how you interact with them from there. If it's a large group, for example, if it were this class, I might not be able to ask you all one-on-one, but you can do a survey, as you mentioned, or you get a feel for it too as you're grading and reading feedback from different learners. So even when you have a large class, you still have an opportunity to kind of gauge how learners learn best, and then to make sure that when you are offering your session, you have a combination of methods. So you're getting a little bit of everyone. But yes, as you go along, you do get to know, even in the large classes I've taught, I get to know the students in the class, and I'm able to customize a bit more as I progress.
Yeah. And with me, with the residents, because residents are usually a smaller group, when you are interviewing the residents for position, because before they end up with you in the residency program, they have to go through the selection process, and also have to attend the interview. So one of the questions you ask them during the interview is, what kind of teaching style do you prefer? What kind of preceptor do you do well with? So you use that interview period also to get a feel from them. And then when they end up with you and doing the orientation, when you're orienting them to the program, you also use that opportunity to fill them out. Because some residents may like the type of preceptors that will clearly tell them what is needed and give them the opportunity to kind of do it on their own, and some may prefer the hand-holding. So anyway, I thought I'd just bring in that perspective of, clinician, precepting, because we also need to kind of look at that angle too.
Okay, there's a question here. Somebody's asking, Dr. Osei is asking for the difference between clinical educator, the roles of clinical educator and a special educator. What is the difference between the roles of a clinical educator and a experiential educator? From Dr. Osei.
Okay. So, Dr. White, you can go first if you want.
What was that?
Roles
Roles of the clinical
educator
an
Yeah,
explanation.
so the
It could always be
clinical
different.
educator is usually a clinical pharmacist.
Mhm.
And as you all know, many clinical pharmacists have specialty areas. And so there may be an infectious disease clinical pharmacist or a cardiology focused clinical pharmacist or an oncology focused clinical pharmacist. And those individuals would have a practice site. As Dr. Pounds mentioned, they may have a clinical site at a hospital or a clinic, and they would teach part-time in that clinic or at that hospital, bringing students from the classroom into those settings. And then they would also teach in the classroom at the university. And so they kind of have a dual role of teaching in the classroom at the university as well as at their practice site.
Right.
And Dr. Pounds, I know you've done that too.
Yeah, and I wanted you to go first, and I will add my perspective in terms of what actually happened. Yeah, and I think that's what I actually stressed a lot, that we may want to look at how do we, if it's possible, to get something like that going on in Africa. And you have to have relationships with the school or the college. So either the hospital, if that's where your setting is, or even community pharmacy, because there is community postgraduate residency too. When that is done, the professor, the clinical educator will have your site as a practice site, and there's collaboration between both parties. So they have the opportunity to see the practice end of what they are teaching didactically in the pharmacy school. And that really helps to beef up the information that they're teaching the students, you know. So I don't know how it is in Africa, whereby 100% of what the clinical educator does in Africa is in this college, or is there such a thing whereby they spend some of their time in the practice area? But anyway, so that's the perspective, yeah. And in fact, Dr. White was also involved to some extent in my practice, you know, but in her own field. You know, I remember we did a lot of research, we did a lot of, you also was a preceptor to my residents when it came to pharmacovigilance outcomes, you know. So it's just a strong collaboration that you build, you know, and it helps both parties.
Thank you for that explanation. I hope that is clear. Okay, Dr. Emmanuel, your hand is up. Can you permit and ask a question, please?
Okay, good afternoon, everybody. Thank you, Dr. White. Thank you, Dr. Pounds. You both of you are great. And the question I want to ask is this. You know, in the last speaker asked a question about how to know the best teaching style that best suits your audience or best suits your students or your residents, you know. But what I want to say, that's if it is clinical pharmacy. Can that also apply in other branches of pharmacy, such as maybe your role is you want to teach your students a formulation technique and you are in the lab, you know, in that case, you see, for me, I think that the teaching style is already laid out. Okay, the student must have to adapt to that particular teaching style where the preceptor climbs the stage, gives initial instruction. Maybe the student watch him or her do the formulation, and then an exercise or the exercise is posted on the wall, and then they are asked to use the formula to repeat the same thing while the preceptor or instructor goes around to mark their practicals. You know, that one, I think it's already fixed. So I was thinking, is it possible to have an alternative teaching style to that? when you are handling students in the lab, and also in also some like if you're teaching pharmaceutics, you know, for me it looks very fixed. You must teach the formulas. You must help them do the derivations. You have to let them understand how the derivations comes to be, and then perhaps they ask questions and you lead them through. You help them understand why the derivations has to be the way they are by using the basic knowledge they already have on maybe maths, physics, chemistry, and all that. You know, so I want to understand in teaching pharmaceutics or pharmaceutical technology, as the case may be, are there styles that one can incorporate from these great lectures that you've given us today? Thank you.
Well, I will also hear what no, these are some excellent perspectives that you brought in. I would say from what you have described, where you can really, and of course I'll have to hear what Dr. White has to say, and I will also like to hear from the other subsequent facilitators. I think we really need to also pose this question. We have a meeting, so I'll pose it. But I really would think that where you can ask or find out what style works for them is going to be in how you give feedback. Like you described, okay, you showed them, because there are certain areas that is fixed with what you just described that you can't change, that is going to be the same, that is going to be presented the same to all of them. Well, but what I think could be different is going to be how they receive feedback. Okay, because you're going to have to assess them. You know, so how you assess them may also be same, but how you give feedback based on how they've done is probably what is going to be different. That's where I think the difference will be. Now, Dr. White, what do you think? That's my thought. But he's correct that there are certain fixed areas with the pharmaceutics. Pharmaceutics is fixed. You're not going to change that. But, and even your assessment probably is going to be fixed. But so if participant A, you assess them and they did XYZ, how you're going to respond to them and give them feedback is going to be different from the other participant. Based on that's what I think. Now, Dr. White, what do you think?
And yes, I agree with you. And as you are reading through their feedback, so let's say that you gave them a pharmaceutics assignment and they had to walk through a formulation example, or you asked them, how does it work in a real dosage form? Or how can we apply this equation to a real drug? Depending on their feedback, that is more kinesthetic learner. But perhaps you are giving them that pharmaceutics example and they're writing down equations step by step, or they are organizing, they're very organized in terms of their mechanisms and definitions. Then that's more of a verbal or a visual learner. You know, you'll have some students, I have some who will draw me a full map of something when I didn't really ask for a map. And so as I look at that assignment, I'm thinking, okay, this is definitely a visual learner because they provided me a whole map in their reply to my question. And then on the other hand, you might have an auditory learner who's always asking you why. They want to talk, they want to discuss, they want to explain out loud. And so they're telling you, I'm an auditory learner. So you can also pick up on some things in their feedback as you're teaching them.
Yeah, that's true. You know.
Thank you very much. Thank you very much. Thank you very much.
But that's a very
Thank you. I appreciate it.
It's a very good question. Very good question. Yeah. And that's why we do what we do. So we collaborate with each other. Great point.
So the time is 4 o'clock. The time allocated for this program is 2 to 4 p.m. And I want to say that we have come to the end of this section, and that further interaction with the facilitator can continue on the platform. As a short video tutorial shared formally on the platform on how to navigate the learning management. The info will be shared again for us to view, so that will make it easier for us to go back to our learning system. The assignments will be uploaded immediately after this meeting, and there's a resource for further reading on this particular module 1. I will advise that we go there to revise the lecture, to read the further reading materials as well. So the recording will be shared later by the webmaster, equally the summary of today's program, God's grace. So because of time, I want to say the class is not closed. The class still continue on the platform. I mean, the learning management system, equally on the WhatsApp. So you can still continue to interact and to ask questions. So I think we want to end today's meeting, and further information will be provided by Professor Para on the platform. Okay.
Okay, thank you.
Mr. Daniel, are you still with us? Okay. So we can say bye for now.
Yeah. Thank you, guys. Really, yeah, thank you. You all have a good one. I'll sign off now. Okay. Bye-bye.
Thank you, Dr. Pans. Thank you, Dr. White. Bye, everybody.
Thank you. Bye, everyone.
Thank you, Dr.
Thank
Pans.
you very much, Dr. White. And, thank you. And bye.